Hi everyone, this is Dr. Rob from Dance Prehab Physical Therapy and Performance. And if you've worked with us before or you've listened in on our past conversations, you know that we always make an effort to truly listen to those in our spaces, not just to our dancers, but also to our families and also to our teachers in our community as well. So this past week, I had the chance to chat with Dr. Lacey Everett for our Sunday Spaces conversation. Dr. Lacey is a doctor of clinical psychology. She is a former dancer. And this is a conversation that we wish every educator, parent, and clinician who works with dancers makes the time to hear. We know that dancers are masters of pushing through. They're always trying to work through fatigue, through pain, and perhaps through some expectations that aren't necessarily realistic. How can we create an environment where listening to the body is treated as a skill, not just something that we pay attention to when we need to, but what if this was part of our process of learning, training, and healing? So Lacey and I talk a little bit about a lot of the dance culture norms that we tend to see and things that we need to rethink, the emotional impact of injuries, and also why mental health really isn't that separate from physical health. Some topics that you'll hear about are this idea of like pushing through and how we sort of approach that conversation, how we as teachers, parents, and clinicians really shape the dancer's mindset around injury, around healing, and oftentimes self-worth, and why we aren't really fans of the pain scale on the 0 to 10. We hear that all the time. So what are some things that we try to do to reframe healing and reframe training? I think there's a lot to be said about the power of language when it comes to mental health. This is something that we both resonate with when it comes to working with dancers in our space. So I know many of you that are listening to this are probably already working to shift these narratives in your studios, in your homes, and in your clinics. And so I hope this conversation gives you some more language, some more tools, and perhaps more permission and empower you to advocate for the dancers in your spaces and in your life. We also did have a little bit of a technical difficulty with our video and audio. So the first half of this is recorded off of my laptop, and the second half is arguably much better. So this whole bit like that.
Thank you, Rob.
Yes.
So my name is Lacey, Dr. Lacey Everett, and I am a doctor of clinical psychology, and I have a lot of family in the Orange County area. I went to Chapman University where I got my bachelor's in kinesiology. I don't know what
I don't know either.
And I work with a lot of dancers. I was a professional dancer myself, and I grew up as a competitive dancer, and then I did dance in the high school. So live, breathe, dance. Yay.
Yeah.
And then I ended up pursuing this passion in mental health for dancers, teens, kids, and it's been a wonderful joy to work and collaborate with Rob.
Awesome.
Yeah.
So far, so good.
Yeah.
Yes. Yeah. So I think for today's conversation, it's really about, once again, like the melding of the two. I think we want to be able to talk about, mental health, and I'll probably start with some of the things that I see as a physical therapist working specifically with pre-professionals and more specifically with youth and adolescents, that I think are things that are worth mentioning within the mental health realm, one. And then two, we want to be able to talk about mental health for performance, mental health for healing, but then also thinking about mental health for performance. And then we want to be able to touch on a little bit on some of the things that we've talked about in terms of, not specific patient cases, but I think just like energies that we're seeing in our spaces that are consistent, and how we kind of ebb and flow between what people need ultimately. So yeah. Is there like an overarching thought on like mental health and dance that you like want to give?
To start out?
Yeah.
Okay.
Start us off.
Okay, start us off. There's so many things to say, so I'm sure I can just start with one thing and we'll domino effect from there. We'll just go off. Yes. So I was thinking, I think it correlates with physical therapy, and we can talk more about this piece, but I think what makes a very healthy dancer is listening to your body. And a lot of dancers are really good at that, or can be really good at that, because they're already so in tune with how their body feels because they move all day and night. And well, I think it's very common to hear, listen to your body, get healthy, get good sleep. It's like, okay, we know, but I think actually understanding, okay, what does that really mean? Listen to my body. It means what textures, sensations, sounds even do I hear in my body? Do I feel in my body? Where in my body do I feel it? And those kinds of things, I think, make dancers untouchable because then they're more likely to get help. They're more likely to go to physical therapy, keep physical therapy consistent, keep mental health consistent, things like that. And I think it really depends what culture you're in, but I think innately when you go out of the womb, literally into this world, culture, your upbringing, we are like our most natural selves. We cry when we're sad, we eat when we're hungry, infants, and then we kind of get constructed in life, depending on what culture you're in or what people you're around, what environment you're in. You kind of get constructed to, I know for here, like in the West or in the States, it's very much like, we're getting a little better at this, but it's still there. It's kind of like, oh, you're weak if you cry, or men don't cry, football players don't cry, and things like that. So it's very common for that to kind of, that innate, most natural state that we come out in kind of gets a little bit lost. And then it's kind of like we have to relearn that person we were as an infant and listen to our body. I'm not saying you have to like cry when you're hungry and things like that, but there's no judgment if you do. I mean, yeah, you can. Hangry, that's a thing. Right?
Yes, absolutely.
So, but yeah, it's kind of just like listening to your body, because your body tells you what's important and your feelings tell you what's important. And when we're babies, you can use a baby as an example. It's a great role model for us.
The perfect example.
Yeah. They listen to their bodies.
Yeah.
They listen and they show emotion when it's real to them. Yeah. And so doing that and kind of going back to that younger self, if you will, helps us to reconnect with that. And once you connect with the way you feel emotions, the way your body feels, like heel ball toe on the floor, like all of those mindfulness strategies, and helps you then know what to do.
Yes.
You feel dysregulated.
I love that.
Yeah.
Thank you. I want to speak to two things. And that one thing is I'm consistently finding that is a general theme with a lot of the practitioners that we've been talking to, but also that we work in collaboration with, is this acknowledgement of the human. I love that you mentioned like even coming out of the womb, because in our past conversation with Melissa Pearson, who is a registered dietitian that we work with, she mentioned the exact same thing. We have an internal wisdom that is, right? The first thing you do is, Melissa says, the first thing you did was when you were born is you breathe and you want to eat, right? So obviously within the context of sort of this innate human need, it's all wired in there. And as you mentioned, as we kind of go through life, we kind of lose that. And as Melissa so beautifully phrasing, we lose that eternal wisdom a little bit. And so in some ways, it's not necessarily about just trying to teach things. It's when we're teaching, we're trying to uncover, we're trying to discover and realize. And from my end with movement, it's the same way. There are a lot of different theories of movement. I have mostly been a fan, I should say, of this idea of what we say developmental sequencing, which is there is a sequence of movements that babies generally follow through development. But a lot of these things are sort of hardwired in some ways, and it's about making those connections even stronger. So once again, discovering and uncovering and watching my son go through that process was like wild. It still is. So yeah, and you know, in our work, I think we try to talk about it that way, where you know you have dance movement, but you are also trying to make sure that you are filling the gaps and maintaining the connection and finding the patterns of just human capabilities, right? A lot of the things that we do in our space, jumping, leaping, crawling, they're not inherently dancey movements,
but they are all given qualities that we'll always have to understand. From my side of things, is how do we optimize it? So I love that, regardless of nutrition, mental health, movement, we're all coming from the space of, hey, you have this ability in you, and what are the things that are not necessarily like overriding it, but what are the things that we have to sort of dig through to find that? Health to me will always be a social and a cultural conversation. So what are the energies that exist that either stifle that? How do they, but in our space, how do we sort of bring that out again? And acknowledge those human aspects. So I think, whenever we say like there's the dancer, but there's also the human who has chosen dance as their method of expression, it's kind of nice to take the dancer out of the dance body and out of the dance experience and acknowledge like 1,000% who they are in those honest moments. So, yeah. So I really, because you were saying all those things, I was like, oh my God, like Melissa said the exact same thing. And so that continues to really resonate. And I think that's where a lot of dance thought process is going, and especially for those of us who work in this space. It's like, there's dance specific shit. We could talk about your using your pliés and your choreography needs and things like that. But as we begin to dive deeper, and this comes from working with, everyone from professionals to retired dancers to college to like all across the life spectrum, there was one consistent thing. You keep digging down. It's I wish I learned this when I was younger. I wish I learned this, or not even just learn, but I wish I had the opportunity to, right? The resources, the space. And I think for a lot of us working in healthcare, there is, I can know dance movement, but deeper than that, what is it? And it's, once again, comes down to curating a space where they can discover, uncover, establish these connections with their once again, that internal wisdom and that internal innate understanding of what we need to feel human and do the things that we need to do. And dance can only benefit from that, right? Dance can only benefit from giving time and space to those aspects of ourselves.
Yes, absolutely. Cool. I know.
Yeah. As you were going to say.
Well, I was thinking a few things when you were talking about that. So, yay, Melissa, that is awesome. But
yes,
and I think that mindset, that method comes from, like, in my training, I gained that knowledge from working with dancers with eating disorders, because there's a disconnect from your mind and body. And you don't really listen to your body as much. You don't notice your hunger cues as much and things like that. So I think that's where a big part of it comes from, is like not listening. It's not like you're not trying. It's just there's a diet culture that we live in around us. And sometimes we're not aware even that we are partaking in those like maladaptive thoughts or behaviors. And another thing was, you mentioned the human and honest. What did you say? It was so good. I want it on a mug. It was honest.
A dance rehab mug. I've never thought about that.
We'll think of it. But
just your most honest self in that moment.
Yes, your most honest self in that moment. And I think, like what you said, why am I doing this? Why are you doing the tendu? What does it feel like to do the tendu or the jump across the floor? And the more it's actually essentially mindfulness. In the West, it's a little different than how it is in the East and how it was traditionally developed. But here it's very much like being in the present moment without judgment. And when you're listening to your body, that's also in the present moment. And it helps when you're on the stage or off the stage, because it's when you're focused on the present moment, you're not thinking so much into the future and fear the future, whether it's 10 minutes or an hour or a year. That's anxiety, that's anxious thoughts, right? And so we all have them, because we're human, we're an honest human, and it's healthy and it's helpful to understand that we will have those thoughts, because part of the human experience means that we will experience, especially dancers, it's inevitable, injuries, it's kind of inevitable, and we will experience sadness, happiness, anxiety, excitement. Like right now, I'm excited. And we will experience those things. And I think it's important to kind of like accept that, because then when it happens, more like, oh, that was a human experience moment. It sucked and it's a human experience moment. And then another thing you mentioned was also on the topic of being a human dancer. I love this. So when a long time ago, when I was stalking your Instagram for dance time, full disclosure, there was a video that was a dancer with a hiking backpack, and she was doing physical therapy with Rob, but she had a hiking backpack. And you said, this is why I love your work, because I feel like you're low-key a mental health therapist and a doctor of physical therapy, because you are like, you entangle the two, because you said something like, oh, look, dancers do something outside of dance. And with mental health, that is so important with what I work with, because there's a lot of dancers and dance instructors too that when you get injured or when you retire, depression and anxiety tend to increase, because sometimes we don't know who we are without it. And we know who we are if we can kind of take a second and go, okay, for these 4 hours, or more like 13 hours if you're dancing like normal. But these 4 hours, I'll use myself as an example. I am Lacey as a dancer. Like when I was a Laker girl dancing for the Lakers basketball team, I would do that to myself. I would say, okay, for these 4 hours, I'm Laker girl Lacey. And then once I get in my car, I'm Lacey. I'm like myself. I bubbly. I like chocolate. I love my cats. I am kind. Like those things about yourself, not what you do. And I think that helped me for when I retired. It helped me kind of not go into that spiral of, oh my gosh, who am I? And it kind of goes for anything. Like, I mean, you've been a firefighter who retires and they attach their identity to it. They're going to most likely go into a little depressive spiral of, wait, who am I? So I think that's a healthy thing for the honest human, is understanding who you are outside of dance too.
And I think, well, going back to sort of the things we see in our space too, and I love that you say, if you're dealing with an injury or dealing with like a hard moment, like it sucks.
Yeah.
Like it sucks. There's no other word for it. And I think even being able to say that to some of the younger dancers in our space, so they can, not everything has to be always like so like happy, positive going. I think it's very, if anything, they maybe don't get the opportunity to do that, like sit and acknowledge how they feel. But I think if, even for me as a therapist, being able to say, yeah, this sucks. There's a path, but I think for their just mental, emotional well-being is being able to, when we say we have to provide a plan of care, we have to provide a plan, things like that within the context of physical therapy. But I think there are a lot of moments where providing that plan for them allows the dancer and the family to see that there is a way to move forward, and that it's a collaborative experience, because the dancers that we work with are often very busy, and that's just the nature of just kind of what the youth dance experience has been, right? I'm going to train at this studio, I'm going to train for this, I'm going to have this private, I'm going to have these competitions, I'm going to have this performance. And that's consistent across the board from youth all the way up to like college. In some ways, even like pre-professional, early professional, when they're trying to gain their, try to like earn their street cred and trying to make their way.
It's like the culture of dance. Yeah.
So I think being able to sit back and say, okay, this sucks. Yes. How can we perhaps make it suck less, and like at least have a sort of, I hesitate to say positive outlook, because once again, not everything is about happy-go-lucky, but I think just to be able to see the light at the end of the tunnel and know that there is support, right? For us, we like to keep in constant contact just to kind of read the person. So even if you're out of the clinic, we like to check in every once in a while just to see where you're at. And I think just maintaining a sense of ongoing support. And I think that goes a long way. You just like a text or like a quick phone call, being able to say, hey, I know you had a competition this weekend. I know you had a long rehearsal, or I know you're in the throes of, hell weeks and things like that. How are you doing? And even those little check-ins. I mean, of course, I want to know what's happening. So if there's modifications I need to make on the exercise end, that's important. But I think even just knowing that there's perhaps someone here just kind of watching out can do a lot for their mental health and also for their confidence in themselves, right?
Yeah.
And then I think being able to reframe a lot of things are important. One thing we try not to do as much, or we don't do at all, is ask, for example, like a 0 to 10 pain scale, just because we know that dictators have a much heightened sense of tolerance in terms of ability to handle pain. Culturally, once again, we have been informed that pain is normalized and it's almost like a necessary thing to do. You have to have your battle scars. You have to, how often have we sat around? I mean, even for us, right? Maybe how often have we sat around comparing, like, oh my God, but you know what? I broke my foot during this. And it almost becomes like a badge of honor. And how do we speak to that? How do you speak that into existence and name those things? And so we can address those things. So once again, we don't ask that 0 out of 10 pain scale because it's very subjective. And then it puts the emphasis on trying to get rid of a noxious stimulus versus being able to restore function. So we always like to ask, hey, what are we doing? So let's say, for example, hip pain, I can't lift my leg as high. And there's I'm still having pain when I lift my leg. Well, yes, let's acknowledge that. It sucks.
Yeah.
But it's a lot higher than it was last week, right? You're able to be in class a little longer. You're able to tolerate these movements a little easier. I know your pain, it still feels the same, but functionally you're doing so much more. And I think being able to shift that perspective does way more than saying, oh, you're still having 3 out of 10 pain. It was 3 out of 10 pain last week, or 7 out of 10, what have you, right? And it's like, well, what does that even mean? And I think being able to, at least from my end, mental health perspective, or at least trying to respect that, is trying to demonstrate that you're still making improvements, you're still making strides, but am I choosing to focus on the thing that the person in front of me may be just like very hyper focused on, or am I choosing to reframe and show them that, hey, you're actually improving? Sometimes I need to do these things for myself too.
I have something for that. I think that was perfect. Actually, what you are describing, this is why I'm like, you are such a mental health minded physical therapist. And you're pretty much saying that what you're doing is cognitive behavioral therapy. It's an evidence-based, we use it. It's, you notice your thoughts, your feelings, and your behaviors. And it's called the CBT triangle, but I like the diamond. Melissa might like the diamond too, because it says you listen to your body. So it's thoughts, feelings, bodily sensations, behaviors, and they're all connected, intertwined. And what happens is we have these automatic thoughts, and they happen. I probably had like 500 from when we started until now. Yes. We have them, and we're not really aware of them half the time. And what gets us in trouble is when we obey them. And so when you have a dancer who's like, well, I can't get my leg up. And it's like, oh, and you also improved from last week. Whoa, what about that thought? What about adding in that thought real quick?
Yeah.
And so it's the same thing with mental health with patients. It's helping them understand all of the things they have done instead of all the things they need to do. And I think, again, culture comes into it.
Yeah.
When does it not? But it's like, we live in a culture that's very much like, what's on your resume? What can you accomplish? What have you not done? It's like, whoa. That's why journaling is really helpful for a lot of people in mental health, because if that's your thing, but it helps because it helps you reflect. It's like, oh wait, I'm kind of cool. I kind of did all these things. I woke up today. Great. Like sometimes that's all we need. But I think we forget that. And then with like physical therapy examples, it's also the same thing with mental health, with keeping it. I thought of consistency when you talked about that. I think was consistency, because for example, the CBT diamond, you can learn it and we can talk about it, and give psychoeducation on it, but it's not going to work unless you do it. It's kind of, I always say there's good news and interesting news. And the good news is that these things work. And the interesting news is that you got to do it. So get it, girl.
Yes.
Yeah. And it's very hard. And so when you describe kind of like the process of noticing their thoughts, reframing them, that's what you do with the CBT modality. A lot of different therapeutic modalities is you reframe the thought to something that's more positive, but still true to you. Like you said, it's like not really realistic to be like, there's rainbows and butterflies now and we're all happy. And it's like validating yourself, normalizing, oh no, this really sucks. I get to miss my dance competition this weekend. Wow, that's horrible. And big giant capital letter underlined, and I'm doing the best I can with what I'm given right now. Or, like kind of reframing it to something that's like so true to you. So it doesn't feel fake, but more positive. And the more you do that, your brain chemistry rewires, and then it becomes easier for you to think that way if you're consistent. If you're consistent, it's the same thing. I'm sure you have a lot of patients who go home and don't do their exercises or the things they're supposed to do.
I feel like I'm like filtering a lot of what you're gonna say to some of it's just like amazing stuff that I'm like, oh, that's so great. I really appreciate that separation, the human and the dancer. I really like that. Because that's, you can take that to any sort of hobby or profession. So I like things that are like core readings that you can apply to other people's forms of self-expression. It's good to have that separation, and then knowing that you have to understand the culture of that self-expression to actually help the person who's in it. That you have to help the person in their own bubble, and you have to decide as a practitioner, like how far you're willing to go for that. If you go bringing question to only answers, a person will have a better understanding of the culture that like lies in that. If you want to go more child markets, like how much can you take from like a first person session from an intake form from your audience?
Yeah.
And also pain. Pain is really interesting. We're learning about mechanoreceptors and CO-receptors right now in swim. So I'm just gonna go back to the pain scale. I mean, see how many types of pain things are pain? Because I agree with the whole theory that they still use that, right?
They do, yeah.
Yeah. But I really like the idea of a pain scale that's like functionality radiation.
I know.
It's something that I can't miss that.
Yes.
Attend to that.
Yes.
Yeah.
I resonate with everything that you were just mentioning, because I mean that's the thing, like 0 to 10, it is very sort of like subjective. And then if you want to, there's a lot of things that we can dive into, but and I love, Lacey, that you were mentioning the difference between East and West sometimes, because we are living in the world of Western medicine, and there are certain biases and prejudices that do exist within the medical healthcare system that just don't account for a lot of different things. So especially in research, right? Most of it 40s white male. And how does that apply to youth? How does that apply to women? How does that apply to people of color? Very, and I think once again, coming from a cultural lens, there's just a lot of those things to take into consideration. Yeah, pain is, even just on the mental health side of things, pain is fascinating because and it's kind of evolved. I would say, I graduated from PT school 7 years ago now, but even our understanding of pain has evolved so much in the last 10 years, right? We were taught that, and this is not a fault of the program, educational systems are what they are, and we're always kind of, to my understanding, maybe like 7 to 10 years behind of where like the cutting edge research is. And so, we were still learning pain as like being able to, or that there are like chemical situations that happen with pain, but we didn't learn as much about like the neuromatrix, and like we understand that there are areas of the brain that can amplify or dull pain.
The amygdala, yeah.
They just told us that originally they thought like that was like pain central.
Yes.
And that's pain is supposed to inhibit other processes of thinking because the amygdala just gets so big. They're just finding out that the amygdala is like a bunch of other stuff. Which was cool. There's stuff, learning stuff about it.
Yeah.
No, and I am too. I think there's if there's one thing that I've really learned, and sorry, I'm totally derailing from. Well, it is part of the mental health conversation because part of that also is, for example, like low socioeconomic status individuals. If you're constantly trying to survive in a capitalistic society, your cortisol levels are probably just on a constant high. And then you're just constantly stressed. And if you're constantly stressed and with anxiety, then your pain levels are going to go up, right? Or your sensitivity to pain is very, very high, or much higher than the average population. And for me personally, this comes from working in an environment where, essentially like a workers' comp type of situation, where a lot of the pain that I was seeing wasn't necessarily, may have started as physical, but over time, whether it's a result of them having to navigate a very sort of convoluted and confusing healthcare system, one, or two, just getting passed from specialist to specialist, I'm like, oh, we just needed to move from here, right? And I'm not saying that I'm okay. In those instances, it's not about my ability to necessarily, I don't have a crazy treatment technique or anything like that. It was just being able to sit and listen to them and be like, okay, well, there's this, maybe we can move through here. And it was at the root of it was a very simple, a physical therapy, mobilization, or physical therapy, intervention. But even at the same time, we were able to make a pretty big difference, but that had nothing to do with my specialty or my education. It had everything to do with they finally found somebody that would be willing to listen and connect, right?
Yes.
So yeah,
it's the same thing with mental health.
Mm-hmm.
It's the same thing. I think we know that we learn the treatments and we learn ABC and in school what to do for this type of thing. For you, it might be the wrist or the knee. And for me, it might be depression, anxiety. And so, but it's so different because everyone is so different and it really is culture dependent. Even different people from different cultures describe pain differently. With mental health, depending where they're from, they're not going to come in and say, I'm so anxious. I feel like I can't control my worry. They might say, I have stomach aches every day and I don't know why. And I went to the doctor and they said that there was nothing wrong physically, So then I'm like, okay, it kind of just depends. And I think that's it's a little bit of a higher level of thinking, creativity. We have to put our mind through in those moments of, okay, we know the treatments, but how do I get creative and one, get this person to stay consistent, and two, join them in their experience and listen to them and things like that.
I had a question about motivation. That was my biggest questions coming here. So you started to touch on it. So I just wanted to throw that in there.
Motivational interviewing. Have you ever heard of it? It's called MI, and it's a therapeutic modality, and it's awesome. And one of my favorite professors, my supervisor, was so good at it, Dr. Ian Shearer. And he's not paying me to say that. I don't know why. But he was so good at it, and I am so passionate about that modality because I know physical therapists learn motivational interviewing in school.
We spent a session.
Okay.
2 days.
Okay. Fun. Yeah. Okay. Better than nothing. Okay. Okay. So what you do is you meet them where they're at. You listen reflectively. So they're like, gosh, I'm in so much pain right now. Ugh, I can't even do my dance class this whole week. You go, oh, you can't do your dance class this whole week. Wow, that must be so frustrating. You kind of restate what they're saying a little bit so they feel very heard, but it's obviously genuine. It's not but you restate, and that gets them, you kind of join, and then it's more likely for them to listen to you or get motivated to do the things when they like you and they feel like you listen to them. They feel like you can connect with them. And so some things you can say is, okay, what's the resistance? What's the resistance? And sometimes they've never actually logically taken a second to even think about that? Like, what's the resistance from you to do this 3 times a day or whatever it is? And then making realistic goals is another really good motivational interviewing strategy. Is like, okay, I would love it if you did this every day for 5 minutes. And when you kind of give them too much, I'm not going to do it. I'm like, that's too much. Like, we're busy. So you want to make it very realistic for them. So you say, okay, you go specific, like what time of day do you even think this could work for you? Can you see yourself doing this? Can you like exercise or breathing? Or for me, it's like mindfulness strategies or therapeutic things. So you reflectively listen, you join them in their experience, and then you ask them what's holding you back, what's the resistance, and then give them time to think about that, and then create a realistic goal, and then explain to them that sometimes this helps too, like having them recall a time in their life where they had to do something that was hard and that it helped them in the long run. Like a lot of kids say, oh, transitioning to high school, and I'm like, oh, I know it was so hard, and kind of joining them. And then, or some patients might say waking up in the morning, if they're in a depressive state or things like that. And what helped back then? Because you're not doing that now. So what helped? Because that we got to hang on to. And that's going to help with that situation too. And then also with motivational interviewing is eliciting change talks. So kind of like after you ask them what they're resistant about or what is getting in their way to do X, then you get them to talk about all of the positive things doing that thing, X, whatever it is, like the glute things or the PT language exercises or all the glute things or the breathing or whatever it is for my end. But you get them to talk about all the positive things about it with curiosity instead of like, this is better for you and you don't want to do that. You want to be curious, not furious. So you want to be curiously open. Oh, wow, you're so right, Sally. Oh my gosh, you're right. That totally would work. Even though you totally know that's the thing. You're like, it's research. But for them, it's more likely to be motivated when it comes from them. So you get them to talk about all the positives. You can do a pros and cons list even and kind of like guide it in that way. If that helps.
Yeah.
I don't know if you have motivate. Yeah.
Curious, not furious. I love that. I'm a sucker for like alliteration, and then I'm a sucker for like rhymes, and so it's like it just makes it stick, Yeah, and I think that a little tangent, but it's that. Well, I'm most of the time communicating with having to talk to younger dancers and things like that. So you're trying to say, okay, this concept, how do we make it stick, right? Both in terms of language, but then I think also in terms of like movement. One thing I learned recently was, we want to, of course, we have all of these ideas that we want them to do, and there's like 1,000 things that you can say, but I think the challenge I give for myself now is like, okay, what are the things that they are going to do even on a hard day, right? And so then at that point, then you're setting the baseline. Like, I'm not asking you to like be your best all the time, at least from like a mental health level, because then all of a sudden they're like, well, I can't, today's not a good day, I can't do my exercises, right? I can't do one exercise, so I'm not going to do my other 6. Versus, what are the simple things that we can do on a hard day? And if they're like, well, at least I can do, we have a very favorite like side plank exercise that we literally give everybody because it's like best bang for your buck. But with that said, it's like maybe you start there, and then that can allow for, at least for them mentally, I think it just provides an entry point to movement. It provides entry point to a cascade effect, a good cascade effect, right? Yeah. So I think about it in that. Well, and going back to what you were saying about like motivational interviewing and trying to find their like what makes them tick. Right? I think for me, that's what I try to find. And that's going to be very different depending on who you're talking to, because some people are motivated by like being super positive, then I'm like, great, I'm going to be super positive. Some people are just need to have the suckiness acknowledged and just be like, okay. And once they can acknowledge that for themselves, then they can like move forth. Some people need, you were saying like setting goals, smart goals, right? Specific, measurable, shoot, I have this written down somewhere. Specific, measurable, attainable, achievable,
Timely.
time-based, and then R is, I believe, relevant.
Yeah, relevant, something like
Yeah.
I will add it in the footnotes.
I used to fall into that trap all the time. 'Cause I used to be so used to like spending hours on the practice on my body. And so like when I started school, I was like, well, if I can't do my yoga practice, I guess I'm not gonna do anything at all.
Yeah.
Like, just going into I don't have an hour to spend. And so it makes you feel like you're just inevitably like regressing.
Yeah.
Yeah.
So how would you reframe that thought? So this is so good. So it's like, okay, gosh, if I don't do this one thing, we call that black and white thinking. If I don't do this one thing, then this happens. It's like, well, what's the truth? You know, it's like, okay, maybe I think you're killing it in like school right now. I don't think you have time. I'm like,
I do.
I'm kind of like, you literally are doing literally the best you can with what you're given. Like that's all we can ever do. And like meet yourself with compassion there, you know? So it's like, yeah, I really want to do this yoga and it makes me feel antsy when I don't. I actually like really relate to this. It makes me feel antsy when I don't. And I'm also doing the best I can with what I'm given. And maybe one day a week I can do it. You know, like something realistic and like achievable, things like that.
I had to like reframe like what made me feel like valid or like I'm progressing because your life changes. So
Yes.
those things have to switch as well.
Yeah, always.
Yeah, exactly.
And I liked what you said too about consistency and motivating patients. And I normally say to take like the self-conscious piece out of it to try to. I say your body, blah, 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 blah. Your body just isn't used to doing PT like this every day. Oh, your body just isn't used to reframing your thoughts every day. And then I always, with dancers specifically, I'm like, you didn't get your triple pirouette overnight, girl. Or like I didn't get my splits overnight, and it's kind of like the same thing. You have to challenge yourself to progress at anything. And getting them to sit in that for a sec helps.
I was thinking about what you were saying about sitting with your body and feeling comfortable with your body. And once again, relating this back more so to like physical performance, since we kind of work in this really gray area of dancers feeling like, oh, okay, my injury's better, but am I medically cleared or am I performance ready? Two different things, right? So one of the things I was talking about with a class I was teaching was the idea of plyometrics and work rest ratios. So if you're working, really quick deep dive into plyometric training, but if you're doing plyometric training, you're really looking at how can I work, depending on what you're working on, but sometimes you're working maximal effort, which means you drain your body's ability to like send messages and signals quick. So it's more neuromuscular fatigue than it is necessarily physical. So then you have to rest enough to do the next set. But you're talking work rest ratios of like pretty high, sometimes like a 1:5 or like a 1:6. And so if you do 10 seconds of work, you're resting for a minute 30, right? 10 seconds of work, resting for a minute. And that's insane because I'm not insane, but what does our body want to do? Our body wants to go. It wants to do the next thing because it's like, I'm ready, let's go. But if we know about the way that the body needs to recover for those types of activities from a true strength and conditioning perspective, you are looking to wait until your body can replenish itself so you can hit the next set super fresh. So we were doing this, we were doing some jumps and we just went across the room, to your regular studio. And it's like, we went back and forth once and I'm like, guys, we're just going to stand here and we're going to recover for a minute. And you could just read the room and everyone started feeling really awkward because it's like, well, I mean, I feel like I'd go again, but I have to wait for a minute. And granted, this is a class, and so we're just kind of following the textbook examples. But I think even being able to create that environment to where like, look, this is how you would have to train, and how uncomfortable our body feels training in that kind of a way just speaks to like what our sense and idea of work is. And so, right, if I were to tell you that like, hey, you're actually going to get better if you rest for a minute, you can perform the next set better, we'll probably still want to go, and I still feel that for myself too. So I just have to, set a timer and be like, all right, I'm going to not do anything for a minute, or I'm just going to do more like recovery work, focus on my breathing, and then do the next thing.
Like you implemented that because of the research that you saw.
Yeah, that's like fundamental strength and conditioning knowledge, right? You look in any textbook. And once again, if you're training for cardio, right, same thing. You're training different systems. So you're like a marathon runner and a baseball player would train their cardio very differently. So I mean that's kind of opposite ends of the spectrum, but you're kind of looking at that work-rest ratio. So for a marathon runner, you're kind of you can coast. But for a baseball player, you're doing spurts of energy, rest, spurts of energy, rest, right? So yeah.
Where do you train dance?
That'll depend, right? So if you're doing and this is where we can get into goals and specifics. So what do you need to do? Your YAGP solo, right? We're doing this in February, and so there's in LA and New York or Florida this year, I think it's like finals and semifinals coming up. And so if you're looking at that, you're saying, okay, your work is going to have to be 2 minutes maybe, right? And so how do you structure your cardio based off of that, right? Whether you're working with us or like a personal trainer or a strength and conditioning coach. So and then if I think about a dancer, they might say, well, I just like run until I'm tired.
Yeah.
Yes. Yeah. Or it depends. Sometimes it's I jog for 45 minutes, but then you're not necessarily intentionally training for that. Whereas I think if you structure it as, oh, I am training for my 2 minutes, and you can kind of do those bursts, physically you're also working towards really building up physiological capacity, but mentally, I think that you're purposefully training. It just gives you that much more of a reason to adhere to the thing, right? Instead of saying, I think time-wise too, it's like instead of saying, well, I can't go for my 45-minute run, so I'm not going to run. I mean, you could at least run really fast for 2 minutes and then rest for 6 minutes, run really fast again for 2 minutes. So I think what's the entry point? Yeah. Sorry, that was a little tangent from your question, but basically, yes. Yeah.
With mental health too.
Mm-hmm.
And I think too with what you said about mental.
Yeah,
it was so good. It was
feeling weird.
Oh yeah, feeling weird. Okay, so it was the more you become comfortable with the discomfort, the better you get. And there's a term, yes, thank you. There's a term in mental health in sports psychology, and it's called mental toughness. And it's where for athletes, dancers, it's where you understand that you can do things that are hard, even though it's not really fun sometimes, or it causes anxiety. The more you push through the anxiety and the things that are, quote, hard, difficult, the more your brain goes, oh, wait, I can do that. Okay. And then the next time you do it, it's kind of like a form of exposure therapy is kind of like how it works in a summarizing, paraphrasing way. But it's the more you push yourself to do something that's uncomfortable, a healthy uncomfortable, an adaptive uncomfortable, like feeling sad or showing sadness or having anxiety and doing the thing instead anyway, even though you don't want to and you're so anxious that you want to bolt. When you don't obey those maladaptive thoughts, good things happen. And over time, keeping it consistent, your brains will kind of go, oh, wait, I can do that. Okay. And then the next time you do it, it might feel less and less and less hard. And it builds resilience, mental toughness in a lot of athletes when they're able to kind of mentally and physically push through, but also understand that doing things non-intentionally might not always be beneficial in the long run. Yeah.
I know we've talked a lot about things in sort of like the rehab, sort of like healing realm. I'm also, and you know, for us, we're also trying to work towards this place of performance. And I think sometimes, you know, people think of physical therapy as like, oh, I only go when I'm injured. But I think there are so many performance enhancing aspects to it. And I think we try to make sure that we fill those buckets as well as physical therapists. I will say that most of the people we generally see are people that have sort of run through the general physical therapy experience, if you will, and just need that, you know, they're medically cleared, they're ready to go back to dance, but they're not performance ready, and they can feel that. Or perhaps they don't. But what can you speak to a little bit about like mental health for performance for dancers and sort of like those simple things? Well, nothing's ever just simple, but things that can be, things that are actionable, things are implementable, you know, maybe.
Signs that like you can see that they're not.
Oh, and yes, and signs that for us to be able to kind of at least get some insight into who are working within our space.
Yeah. So signs, and then, so I'll do signs first. Signs are a lot of times when they're losing their interest in things that they're really interested in. Even if it's not dance, if it's like something else, like a hobby they really enjoy, and it's different than changing passions or changing to something else. It's like they don't change to something else. It's like they're just kind of losing an overall interest in dance or in things. That's a really good sign. Also, their energy levels are a really good sign for a lot of different things. But typically when you notice, it's awesome when dance teachers will go up to the dancer in private and say something like, hey, I've noticed your dancing hasn't been like your normal dancing. I'm curious what that's about, you know, instead of shaming or, you know, just very open-ended, see what they say. Even though the dance teacher might know, okay, they're not eating, or okay, they're so anxious, they're vomiting before performances or whatever it is, it's good to help them become more comfortable with talking about it to them and seeking help. If you label it like that, if you label it like, hey, your energy lately has been a little bit lower in your routines, I wonder what that's about. I've noticed it. Or I've noticed, hey, your mood, I noticed your mood is a little different. You don't want to say, hey, you're being a little sassy today, or like to say it nicely. You don't want to say like, you want to make it very, I've noticed, and then fill that blank in with a behavior that they're doing. It helps with their self-esteem. And then, so that's a way to kind of like bring it up to people. But signs are definitely similar signs to burnout, you know, but sometimes they're not able to locate or label that it is burnout, is lack of interest in things that they're typically interested in. Feeling kind of down most days is a good one. If they're kind of talking in a way that's fear the future thinking, like they're very worried about things, worry. They can't seem to control it every time you're like, okay, and have you tried that? You know, it's kind of like a fight or flight feeling that you can feel off of them. That's a really good sign. I feel like it's hard to explain, but when you're in the room, you'll know. Like therapist or not, you can tell if someone's kind of in that fight or flight, antsy state, heightened, like tense. You could probably feel it in their muscles. Yeah. So it's there's physical signs and verbal signs, and then behaviorally. So you always want to watch their behaviors. So if they're all of a sudden showing up really late, all of a sudden no showing, all of a sudden having stomach aches or nausea, because there's a part of our brain that's connected to our gut. Anxiety kind of moves around sometimes, and some people experience really heavy somatic symptoms. So, for example, like a lot of kids or just in general working with kids, They're not going to sit there and be like, I've noticed that I feel very anxious due to this past thing in my family. Like, they're not going to sit there and say that. So they're more likely to say, my stomach hurts every time I am 10 minutes away from school. And it's like, okay, what's happening at school? You know, or like they're going to say, I can't sleep, or I'm not hungry, or I keep getting nauseous every time I go to this one dance class. So it's like the physical signs, especially with kids, is a really big one because they're not, you know, they don't have that emotional vocabulary yet to kind of state like, I'm feeling anxious, I can't control my worry, you know. Sometimes even adults, you know, it's not super normalized to talk about those things sometimes anyway. So, and then when they do tell you, thank them. Oh my gosh, thank them for telling you, because it'll be more likely for them to tell you again, you know, when you give them an open space, a response that isn't like a crisis response, like, oh my God, like, go to the hospital. You know, it's like, okay, what can we do? Let's problem solve. Wow, I'm glad you told me this. Like, give them space, because then it's more likely they'll tell you again. Did that cover the sign? Okay. You're like, yes. Okay.
Yeah.
Okay. What was? Yeah, please.
I just wanted to follow up with a few examples in my own work, like related to some of the things you're saying. But yeah, whenever there's a younger dancer or anybody really that says like, hey, I'm feeling this thing, or like I'm like injured or etc., my first thing is always thank you for telling me. That's the first thing I always say, because you have to acknowledge that they are also taking a step out of their comfort zone to even admit that in the first place. So one, I always say thank you for telling me, and two, some things I tend to see, at least in the clinic with younger dancers, and once again, we're very fortunate to work with them the way that we do. We spend a lot of time with them, so I think over time you really begin to learn their quirks and things like that. So with those that we're very connected with, if you can begin to notice just like, oh yeah, like something's a little off today, why? You know, I mean, even little things like, sometimes we have like little tics and things like that, like maybe like picking at fingers or, you know, certain little like behaviors like that. Sometimes I'll pick up on, and I might not necessarily speak to it, but I'll just keep it on the back of my mind. One, two, I think being in a space where they are given agency is often unfamiliar too, because they're so used to having to listen to the person at the front of the room. So some behaviors I kind of see sometimes is, are they, you know, waiting for me to give them some sort of like positive affirmation? Are they like side-eyeing me because they're wondering if I'm watching them to either give them a good critique, or am I critiquing them at all, right? There's some research out there that like dancers respond worse to no critique than bad critique.
Silence.
Yeah, silence is huge. Yeah.
Talk about distorted thoughts.
Yes.
They hate me.
Yeah.
Oh my gosh. I think
I mean, for me, that was not necessarily in dance. That was just my parents are very Asian. So it's like, you know, you're like, oh my God. Yeah. What else? Yeah. Some other things I feel like I might notice would be, I mean, it's kind of unfortunate to say that I feel like we've dealt with some cases of, you know, chronic pain, psychosomatic pain, where stress is manifesting as physical pain or coming back from past injuries. And long story short, there was a lot of like consulting with different specialists and things like that, medical doctors, psychologists, etc. And the thing that made the most difference was changing studios. Yeah. So it was like, and it had, I'm sorry? Changing the space. Yeah. So, I mean, if you're thinking the biopsychosocial model, right, which we can dive into a little bit, but biologically, psychologically, and socially. So the space dictates a lot of different things. And I think, once again, a little tangent, but I think about I work with a lot of ballet kids, right? And I work at a studio where I do strength and conditioning with them. But I think, what does that space signify to them, right? Like when you see mirrors and a ballet bar and white marble floor, you know, it's probably, even for those of you who are watching or listening, it's probably eliciting some kind of like
I feel it right now. I'm already there.
Yeah. So what if we took this space and I'm going to make you run around and bounce balloons off your head? And so, which may or may not be an activity we do in our quote unquote strength and conditioning class. But
through movement, you've been able to redefine their perception of the space, and therefore there's a different association with the space for themselves mentally. So now when they walk to the space, they can acknowledge that, hey, this is where I work, but potentially this is also a place where I can have fun, right? And it's not always just like the person at the front of the room, right? Especially for us working in physical therapy and working with kids, we want it to be collaborative. And so, this is not just another space for you to come and listen to somebody and follow instructions all the time. And if you're doing something bad, I'm going to tell you that. But it's like, hey, where are you at? How do I meet you there? And how can I create an environment that is going to be conducive for, physical healing, yes, but also I think with how much we know about how physical deals with mental, you have to create that comfortable space, right? Even for you as a person, or just kind of like what things they associate the space with. So just speaking to some of, I guess, going back to some of the signs I often will see, or at least preemptively trying to set them up for success. And when I say set them up for success, I mean invite them into the space so that they don't have to come in feeling anxious already, because injury is already anxious enough. Anxiety inducing enough.
And
Oh, just to come back to I don't know if you have other things to say, but signs and then performance. Yes.
And this goes along with the anxious piece too, with injuries and things like that. But a lot of times, when dancers are burnt out, there's been days I'm like, oh my God, I don't want to go. And it's I love dance, why am I? But there's days like that where you're just, I don't feel it. My body doesn't feel it. And when you go into the class and you're kind of they're having you do a warm up, or they're having you go across the floor, what typically helps is thinking about, you say to yourself, you add the thought, how can I make this enjoyable for me? Because I'm kind of not there yet. You can make it about you for a second. You're not really all there right now. It's kind of a foggy day for you. And you say, how can I make this enjoyable for me? And sometimes just saying that alone is enough. Sometimes just noticing your feet on the floor and the things around you with no judgment attached to it, mirror, okay, wall, okay, stereo. What is this sound? What is the sound? How does it vibrate my feet on the floor? How does it, you go to your 5 senses or billion senses that we have. So that typically helps with performance too, with burnout when you're in the studio, and with performance, because the more you can be in the present moment, the better you'll be in performance. So when you're backstage, you probably aren't aware of them, but maybe now we will be, but after this, you might have all these thoughts that are going, oh my God, I got to hit this specific dance in my soul, this part in my solo, because it's just killing me. And oh my gosh, I need to make sure I want to get first overall, blah, blah, blah. You're going to have all these thoughts race through. And the second you go, are these thoughts helping me? It also takes you out of it. Sometimes just noticing that you're having those thoughts already disconnects you from them. Because what happens is we have these thoughts, and then they elicit these intense feelings in us, and then maybe behaviors, maybe we slip a bunch because we're kind of psyching ourselves out already, and it's there's a few things you can do. Oh, already had that thought. If your mind goes there, if you know yourself enough to go, okay, I typically, that's me off the stage before I go on, my mind just does that. If you already know, with compassion, silly me, there it goes again. My mind, did that thing again. Okay, let's go back.
I have a question about that. So, there's that saying, and the truth, and the way you practice is how you perform.
Mm-hmm.
So let's say you have a dancer or an artist who has practiced in an unhealthy way, right? So they become really rigid. They become really focused and self-motivated to perform well. Mm-hmm. And then you're trying to get them to transition to a healthier way of training and of mental fortitude, a different way of framing things. And then they start to perform worse because they're not used to training that. The way they get there is not an option anymore because people are telling them it's not helpful. So like, I wonder if you guys ever experience like transition error or like transition regression from being able to get to where you need to go through an unhealthy way and then trying to transition to doing it.
I love that. It's actually really common. That's actually really common. And I always use that body statement. It's because your body isn't used to it yet. And I use this example a lot with teens because maybe it'll make sense in a second. But you know how acne medication, sometimes they'll say, I swear this is related. They'll say with acne medication, like, oh, your acne will get worse before it gets better. Sometimes it's the same thing with mental health is you're not used to it yet. And you might even become more irritated because it's new to you. These new ways of being, these new therapeutic modalities, these new chiropractic treatments, you're not used to that yet. And so you want to normalize the heck out of it with them. You want to say, I say, oh, of course it's not going to be 100% right now. I say also, like, it's a recipe. It's literally a recipe. All the things that you just named are a recipe for how you're feeling right now. Because why? And I also say, why would this be easy? Our bodies innately also, we don't like change, you know? And anxiety is like fear of the future, about control. Control is anxiety. Anxiety is control. It's kind of like we don't like change, even if it's for the better, because our bodies, it means that it's something unknown.
So you just like, I guess I'm like, have you already established that trust? Because like they have to trust you, like and trust what you're saying to actually make those changes for themselves. So like, if you place that after you've established a great like trust, or like, I guess timing is important. I don't, because I feel like that's like for chiropractic, that's one of the big things we get taught about, how like new people come in and if they've never had anything like it, like you have to quickly establish like trust in your profession or trust in your knowledge. And I just wonder if like there's a certain place that you try and place like when you're gonna try and transition them. Like are you like, okay, they trust me now.
Oh, well, yeah. Well, you know what? I feel like for example, like to make it more like a process comment, like for you, Medina, I feel like I trust you. And it took like not even an hour. Like you're very genuine. And I can tell you work really hard because you're like literally taking notes. So I'm like, okay, I'm like,
And you're here on a Sunday.
Yeah. I'm like, you work hard. Your behaviors, watch their behaviors. But not to single you out, but it's kind of like sometimes you can build rapport in like 5 minutes. But sometimes with people who are more resistant, it's going to be a little bit longer. And it doesn't mean they're bad or you're bad. It's just what is. It's just what is. But with like the series of events, I think is what you're asking.
Just like how have you, like in your experience, like what have you found the most success? Is it at the beginning? Is it like, do you time it? Like, okay, I know we have like a big thing. Let's not do it now. Like how have you found the most success?
Oh, well, I think for me, I think it goes back to kind of what Rob was saying too, is like, it depends, but it depends. And I think because you have the schooling, I think you'll know. In the moment, I think it's like almost like having us do what we preach is like, listen to your body. It's like, I think you'll know. And it's like when you can trust yourself, they feel that. They feel that. So, but that's kind of my summary, but I feel like you might have some good things.
It depends, unfortunately. But I think the biggest thing for me is, and this might just be more so like transitioning from student into clinician and then from new clinician to slightly less new clinician and over time, but I would say at the root of it all, it's listening to the person in front of you. And I know that sounds so generic, but some of the things I'm watching for, once again, are these little signs. When they come in, are they like, oh, this is weird? Like this is, we operate out of a gym. And so it's an unfamiliar environment. And so it's like being able to introduce them to the space. So right off the bat, if I already recognize, and generally speaking, they walk into our space here and they're like, oh, this is different. but I'm inviting them into the space right off the bat. I'm saying like, hey, if you've had physical therapy before, or we do a phone call before our clients come in before their first visit, so they already know who they're going to see, and I already know what they're dealing with, and I've already talked about like a very baseline plan, right? So because if someone says, oh, I've sprained my ankle and I have a performance in 3 weeks, and you're like, okay, I can set the stage for that right off the bat, even just over the phone. I'm already starting to build my connection there. If someone says, I'm having knee tendonitis and I want to get ready for a summer intensive, which now is February. So, off the bat, I'm like, cool, we got like 3-4 months. I can set a timeline for them on a very baseline situation based off of tissue healing timelines and give them sort of a plan. Where are they going? Are they going to and my references are mostly ballet because that's a lot of who we see, but are you going to go to a school that is more Vaganova based, which is, really going to emphasize like flexibility, for lack of, how do I say this? I'm generalizing here, but it's like if someone's going to go to a Vaganova based ballet program versus a Balanchine based ballet program, I might structure their rehab differently, or I might explain it a little differently, right? If and once again, overgeneralization here, but Vaganova, lots of flexibility, lots of like 190 degree turnout, lots of emphasis on like position and things like that. Whereas if I'm thinking Balanchine, sometimes it's a little bit more flowy, it's a lot more quick footwork, there's a lot more movement. And so then being able to say, this is what we're going to work towards, and they have that idea of like what they can expect, then right off the bat, I know that I've set a expectation off the phone call. So when they come in, they are already knowing that there's a way forward. There's no time where I feel like, oh, you trust me now. Yeah. Although I do feel that sometimes, and you can sense it in their body language. You can sense it in maybe they're talking more. Maybe they're talking about other details of their life. Yeah, they're not guarding as much. And I think I think those are just a few examples of like, when I think about creating rapport and creating trust, those are some of the things I'm thinking about. Do they believe that I will help them make sense of their life and their experience in this moment and the next? And if I feel confident that I have helped them to make sense of what's going on and a path forward, then generally speaking, in that place, we have built some solid trust. Yeah. Yes. It takes time to build, and it's, and we've probably all been there at some point. It breaks so quick, right? So I think just being able to stay in communication is also really hard sometimes, depending on the situation. And then can I ebb and flow? Once again, the situation might change, but can I continue to help them make sense of what is going on? Yeah. Hopefully that's helpful. We are nearing our end. Yes. Are there any, I'm not really sure what's happening on the virtual end, but with that said, any other thoughts, comments, concerns? I know we hit on a whole bunch of different things. I might send this to the people that logged in virtually and have them send questions later. But yes, if you're listening to this at a later date, yes.
Yeah, I'll just say like in school, like currently, I'm still pretty new. Like I'm in only my second term and I have 12 terms. So right now, everything is like really anatomical, technical, and biomechanical. So it's just really nice to get the other side of being a practitioner. Yeah, like, because I know it's important, like from like my dance training and like dance school and just life. So I know it's important, and I understand that, right now in school I need to just learn like the foundations, but like I really want to make sure that like I have this side of things as a lens, like as I'm learning, like I really just want like a encompassing lens so that I can better like know what I want to do when I'm out of school. Mm-hmm. So thank you for holding this.
Yes,
it's so cool. Like
very welcome.
I really appreciate it. Thank you so much. And so I just found this place. Like I was on Instagram, and I found this place like 3 days ago, like 2 days ago, I think. Wow. I got some advice from a chiropractor who was about to graduate, and he was saying like it's never too late to start entering the space that you think you might want to go, just to check it out. And I think this is like my space. So like that advice just led me to start looking on Instagram, emailing like companies, like who do you refer out to? Who are your practitioners? And I found this place, and I'm so happy. Yeah, so
and thank you for being so receptive.
Yeah.
I'm excited for you.
I know. So, and I think, school we have to do the thing. I will tell you that when I went into PT school, I just acknowledged that it was just like, I have to go through this in order to get to the place where I want to be. And it's over a course of a long period of time. I also don't feel like I'm where I want to be quite yet in terms of what I feel like my calling is. But yeah, we kind of have to go through the thing. But with that said, I will say that what has influenced my own practice in terms of what has influenced my practice in terms of working with dancers now has been informed by working with younger kiddos, ages like 1 through 3. It's working in a acute care hospital, working in home health, working with watching my son grow up. You know what I mean? Yeah. All these things have informed me because it's taught me how to communicate to people in various contexts. And I think that's the most important thing, is making sure that contextually we continue to see who the person is, what their environment is. And I feel like inherently, if you're thinking about context and you're thinking about space, the mental health considerations naturally come because you can't not see those things. Like I would say you would have to be pretty myopic to see just biomechanics, right? I don't know if have you ever taught dance?
Yeah.
Yes.
Yeah, I thought.
Yeah, great. No, I love that.
I was a child myself.
Yes. I mean, that's okay. But I mean, that's the thing. I think about, and sort of seeing things from a different lens, beginning to think about, yes, I'm a doctor of chiropractic, but I could be that, or thinking about like identities and things. It's also like, you're also a dancer who has chiropractic knowledge. And I think that helps me a lot because it takes me out of my like medical brain and into my dance teacher brain. I used to teach dance a lot too. And so being able to see the person as a student, not as a patient, seeing the person as someone who I can positively like influence and not just fix, and being able to honor like that, my experience as a teacher in this new profession with renewed knowledge. So I think that is really helpful to kind of say like, yes, I have to do the thing, but I am also more than that. I'm not going from dance teacher into healthcare professional. I am to blend. And at the root of it all, we're all teachers. So now I have a new base of knowledge to be able to draw and inform everything I knew in the past and bring that into my method of care, whatever that looks like for you or whatever that looks like for the person in front of you.
Yeah. It's a good way to build rapport because then right away they're like, oh, you're a dancer too. It's like, they get me, like I think it's a lot about building the rapport with right away with working with dancers. Like if you have a niche and you've experienced that niche, it's like already before they even meet you, they're like, oh, okay.
There's a level of trust.
Yes, exactly. Yes. But thank you both for
me. Thanks. I know. I love doing these. It's so much fun to kind of leave things open-ended and talk about things that are important. And yeah. Yay.
How it informs your practice, like doing something like
Yeah, I think it helps too. Like when we say things out loud, it's like, oh, wait, yeah, I really want to make sure I keep doing that in my practice, or things that we talk about. But it does, like all of our experiences in life are never a waste. It literally has helped. I never thought I was going to be a doctor. Like what? And so I know. And so I just wanted to dance. That's all I wanted to do. And then I think dancing helped me in like tenfold in my work now. Oh my gosh.
I always look back at my program and my dance training and education, and I'm like, that's what taught me how to feel, just in life, and I don't know, I just feel like before that, I feel like it really transformed my brain. Like dance has really, really transformed my brain to be able to like try my best. Like, you know, use your hand, to just try my.
You have mental toughness. Yeah, exactly. It helps. That's exactly what it does.
I noticed that in my study now, like chiropractic, it's all about feeling. It's been like so helpful.
Oh, you're right. Yeah, it's like you really have to like go within. Like you really have to go there.
It's on a tool.
Yeah.
A tool to feel someone else's restriction or flag or whatever it is that you can gauge from just like your perception. It's
So
it's
I
really
can see how
fascinating.
dance would completely help with that.
So helpful
already.
Yeah. Just knowing how your body works.
Yeah.
Well, yay, go dance prehab. And thank you, all of you, and Rob.
Amazing work that you guys do.
Thank you. Yeah, thank you all so much. And then if you're watching this video, my kid is here. I mean, we're talking transitions earlier, right? So this is a big life transition for my wife and I.
Mindful he was, like, talk about like present moment. He walked in and was like, video. Like it was like that's all we in a dance room. If we could go back to that,
Yes.
like the floor, my feet, videos. Like we're so healed.
Yeah. So thank you so much, Lacey. This is great. And then all our conversations are wonderful. I look forward to all of that. And then thank you all for coming, and thank you all for being here virtually and watching. Can't see if you're here, but yes. All right.
Virtual people.
Yes.
Thank
Thank you. Thank you.
Thank you, Rob.
Cool.
Have a good day.